My purpose here today is actually to be helpful to those in the audience who want to play some leadership role in the final phase of this round of debate. So we have enough gray hair to know this is the fifth debate since World War II on national health reform, and regardless of the president's impassioned speech, it will not be the last. We're not going to be able in one piece of legislation in our political environment to solve every issue that we've been debating for many years. The question is what outcome comes out of where we are. And what I'm going to talk about is the public opinion in the final phase. And what's very important for everybody here to understand is the public is only one actor in this. Every now and then people love to look at polls and then they try to predict what the votes will be. It is one actor in what ultimately will happen with the Congress. But I want to talk about that actor today. And then I want to talk about Massachusetts' role of impacting, not for people in this state, but outside the state, this debate. And we're going to talk about the public perception in the state. And for those of you who don't sit in front of your online New England Journal edition at this very moment, we have a survey out today on physicians' views of the state. And I want to thank the medical community. 1/6 of the physicians in this state answered the survey. And so I'm not going to go through all the results. What I'm going to go through is the results that will be important to people outside the state, as distinct from a lot of things I think that you can gain insight about what's going on. I am going to summarize something so simple, so easy, but it will change your view of how you look at the newspapers on polls. So this is what we have been about. Since June, there have been 50 polls on Americans' views on health care reform. What we did was analyze those 50 and compare them to the trend during the Clinton health reform era. And this is what we found. In the final phase of the debate, what counts to people is not their answers to how popular elements in bills are, but their perception of how it impacts on the country and their families. And so what I'm going to explain in a minute is that in Clinton, this phenomena was really very strange to see. You would ask people about things that were in the Clinton bill, and they would say, I like it, I like it, I like it. And then you'd ask them about how they felt about the bill. I don't like it, I don't like it. So you had all these elements, and this newspaper said, the equivalent of the public plan, unbelievably popular, and you keep seeing going down here. And so then you looked at another set of questions. And one was whether or not you thought the bill was good for the country. And the results were mixed. That is, on some matters, everybody, and this is what's very important, and Jim and I'll wrestle with this, people never understand what's in these bills, but they have an impression about them. And so their impression was back in '94 that it really would help the uninsured in this country. It was the right thing to do. But at the end of the day, they opposed the bill, even though they knew that. And there are other things about the bill that they thought were good. What really strikes me when you go back to '94 is that when you turn to your family and said, how would the Clinton bill affect it? The object should be most people should say, I'll be better if this is passed. And if they're not better, at least they shouldn't think they're worse off. And on every measure of the Clinton bill, what you found is that the majority never thought they or the family would be better. And of those who thought there would be a change, the majority thought it would be for the worse. So when you look at the outcome of the Clinton plan, what you find is these elements are popular, a mixed view about good or bad for the country, and people dropping their support because so many people are scared it would be worse for their own family. And so what we've started to watch in this final phase is not how much, and I'm going to go through the elements, people love the elements, but first of all, if they think this is actually whatever it is that Congress is about to do is good for the country, and then secondly, good for their family. Now I want to make an important point. Healthcare is extraordinarily unique in the public opinion area about this focus on families. The other debate now going on in this country is what we do about the war in Afghanistan. No one answers the question of where we go based on what's good for my family. They do not discuss it or think about it. It's what's good for the country. What's the right thing for this country to do? But in healthcare, the debate starts out how terrible the problem is, and then it starts to evolve down how it affects my own family. So that's where I'm going to show you Massachusetts gets to be very critical, because every poll that's currently asked nationally is hypothetically. If a bill is passed, what would happen? There's only one spot where you can interview people where something happened and figure out what happened to their lives. So that's where I'll show in a minute. Massachusetts gets to be very, very important. Politically, you would have picked Ohio. So if I could have gotten the one state to have done this, why would I have done that politically? The state that voted for McGovern is not a role model in America. It just isn't. I'm sorry. I can't go down to Mississippi and say, let me show you the data about how happy they are up there. So it's not the ideal place politically to have your role model. But America doesn't work that way. It's not controlled studies. We pick our clinical experiment in Ohio and they get universal coverage. We're it. So let me briefly go through where we are on the options and explain with some humility the way polls are used or not. In the polls, a lot of issues are discussed with people. Some of them are very popular, some are very unpopular. Then advocates pick the ones they like, and that's what's discussed all the time. And so people who just say, well, politicians mindlessly follow the polls, I'll show you in a minute, it's not correct. There are things in these bills that are quite unpopular, and they're just moving along. And there are things that are not so popular, and they're moving along. So where are we? On the public option, basically, Americans like the idea of choice. The insurance industry is running close to tobacco and oil. In terms of where people feel about that. So having a choice makes sense. When you query people, should it be Medicare-like or something like that, there's not a clear pattern at the moment between all these polls. What is a clear pattern is that people would prefer some sort of an other option that they could have, long as they know they don't have to take it. And that's really what's attractive about this particular debate, is that it's not about Canada for all of us, it is Canada for some of us, or if you like it, or want a choice, or something like that. And if I don't like it, I'm just going to keep going what I'm doing. So that is incredibly American in the value system. The individual mandate, which only exists in the state of Massachusetts and is described by political figures in 80 different ways, but let me explain this, is very important for this. If a poll says, do you think we should require people to have health insurance, period, half say yes, half say no. If you say in the poll, we're going to provide, the government's going to make it so it's affordable for everybody, but you have to be required to do it, it goes up to 70%. If I add, there's a penalty, it goes down to 47%. So what are we talking about here? For that. And so Massachusetts was a generous state, it is a very generous state in providing people support, and early on the penalties were quite modest. But some of these bills have penalties that have $3,000 in it pretty soon, and for some number of people who just told you they like the individual mandate at one end and get very scared at the other. But since we are the only state with even any real world experience, we are interviewing people who don't have a clue about how this would work, but could be in love with it or scared with it, depending how the final phase of the debate is discussed. Let me deal with Medicare cuts and what is an urban legend. And let me see if I can explain this, and I think the medical community will enjoy this. Over the course of some number of years, two senators ran into seniors who said to them at one of these screaming forums, keep government out of my Medicare. And they have told that story so many times that it actually buries what is the real truth. Let's explain what they actually meant. That is, seniors overwhelmingly know Medicare is the government program. It's not at all correct. What they mean is, and I work a lot in the Social Security area, where people would say, keep government out of my Social Security. And what they meant was, there's a trust fund in Social Security, and seniors believe the government is stealing from the trust fund. When they say keep government out of Medicare, they believe they've paid their whole working lives into a Medicare fund, whether or not it exists or not, and how much is there, plus they pay every month. What they have heard is that hundreds of billions of dollars, just look at the front page of Miami Herald to figure out what's going on here, $100 billion is being taken out and given to other people.